I'm going to invite Jen Davies up now. So Jen is you know when you kind of want to be a person, like I want to be Jen really. So Jen Davies is an amazing psychologist, and we've been doing a piece of work about what does it look like to support families with small babies in difficult circumstances, and how do you build that attachment, and what does that look like? So I'm going to pass over to Jen, and then Jen, you're leading into lunch.
Yes.
Woo-hoo.
Yeah, my stomach has let me know I'm leading into lunch already, so sorry if we've got a bit of that noise coming through. That's a lovely introduction, Laura, thank you. That was really nice. Hi, I'm Jen, as Laura said. I'm a clinical psychologist. And it's been lovely to have a chat with a lot of people in the room already, and I was just saying, actually, Jane and I were saying how rejuvenating it can be to kind of connect with people who have similar values and have chats. So thank you, everybody, for being here. I work therapeutically with families in the perinatal period, and I'm going to talk specifically about the work that we do with families in temporary accommodation. So when we're talking about the perinatal period, we're talking about people who are planning or trying or preparing to have a baby, or someone who's pregnant, or someone in their family's pregnant, someone who has a baby, and or sadly people who've experienced baby loss. Whether that's through miscarriages or stillbirths, or through having children removed as well. So basically, my work is anything to do with babies. And why I do this work, why we think about working in the perinatal period is, well, it's a couple of main reasons really. One is about babies and one is about parents. So the first one about babies, I'll let this kind of quote sink in for a bit, but Robin Balbirnie, who's a psychotherapist, talks about how probably the most important period in everyone's life, that's all of ours, is one that they cannot remember. So it's that period of life before we have words, before we have conscious memories, but where we might somatically hold stuff that happens to us. And that's why it's so important for us to get in there early. And really over the last few decades really, the evidence from neuroscience has been really emerging to sort of say this is the most important time to get in. They talk about the 1001 critical days through pregnancy and through those early years in life, because that's when the architecture of our brains is built. So the experiences we have there can have long-lasting implications. That's why we want to get in, that's why we want to do this work. The better experiences we have earlier on, so the more our parents are able to tune into us and respond to us, the richer our neural networks will be. And the more able we will be able to cope with the challenges that life throws at us and with any traumas that might come along the way. Doesn't mean that difficult stuff doesn't happen later, but we're more equipped to do with that. So that's really one of the reasons is why we want to kind of get in early. And if we think about as parents how difficult it is anyway to tune into babies, try and do that when you're living in temporary accommodation and you're feeling unsafe. So it's really important that we offer the families the support they need. Okay. The second reason is about parents. So I have yet to meet a family who have not said, I want better for my baby than I have had. And that is all families. So people who would say, I've been really lucky, I've had amazing experiences, but they'll still want something different. They'll still want just a little bit better for their babies as well. Actually, you said that earlier, you want your daughter to have something different than you experienced. And that's absolutely kind of the case. And that's why this period is so good to get in there and work with parents as well. At this time, you can see there's real increased motivation for things to be different. And I think we see parents able to do things for themselves at this time because they're doing it for their children that they might be less able to do at other times as well. So we get this lovely double whammy of being able to improve things for parents as well as for babies. And we can really break some of the trauma that can be passed down over generations as well at this time. I'm just going to sip my water. And then there's the third reason as well. So this reason is an economic reason. So I don't know if people are aware of James Heckman, who's a Nobel laureate who kind of produced this curve, which shows actually the earlier you intervene, the better returns you get on it. That's what the curve is kind of showing. Get in really early, get in prenatally, do helpful stuff, support, you get much better outcomes than if you wait. And another way of thinking of it is that actually you reduce costs later on. So it was about 10 years ago they introduced the stats around perinatal mental health, and the cost being about £8.1 billion, they said, in the UK. And about 72% of those costs to society were around the impact on children as well. So it makes so much sense on a financial level for us to get in early. So that's the kind of the justification for doing some of the work, the kind of the impact that you can have for babies, for parents, and also for society. And that I feel like I've known about for years, but one of the things that I was asking myself in the 20 plus years that I was doing this work is, how do we still get to the families who most need this? So there's some amazing services out there, but how are we still not reaching the people who could really benefit from it most? And so we set up this pilot project through Shared Health Foundation to kind of offer these infant parent services, but in a GP practice, in a primary care setting. So the idea that it would be a universal service, and that would make it more accessible, and actually through it being offered to everybody, that you would actually be able to reach the people who had the greatest need as well. So we started to do that in 2020, and we were able to offer no waiting lists. We were able to kind of reduce the stigma that sometimes comes with being referred to mental health services, having to wait for a referral to be done and then be sent off, because we became Jen, and shout out to Maria Shower at the back of the room. Jen and Maria, who sit in the room around the corner, and you get like referrals from trusted people. People know you, so doctors, nurses, receptionists can say, "Oh, have you seen Jen? Have you seen Maria? Oh, they're just round there, bob in, say hello." And you get much better take-up of services by just being present, by being seen walking around as well. So it's actually through that work that we started to link in with some of the families who were living in temporary accommodation in the area. So we're really lucky that we get to kind of work into 2 different settings currently, where we go and do outreach visits weekly. And again, thanks to Maria and some of the other brilliant trainee clinical psychologists we've had in placement, Rosie and Gina, who've been building those relationships. We go and say hi to families, they get used to our faces. With some other local community groups who've set up a toy and book bag initiative. So we go when families move in and we say, "Hi, this is who we are. We've got this bag of toys and books. It's pitched for the age of your kids. There's a little bit of information about what they might like to do in there as well. We have a chat about what games you think they might like, and we start to get to know the families as well. We also have been looking at this photo is a picture of a space that we've created in one of the TA settings that we're in, and we started that by basically turning up and every week kind of clearing a corner of a room from like the broken bits of furniture, scrubbing it down, people being a bit interested about what we were doing, staff members within the TA starting to say, what are you doing? Oh, right, that's interesting. I've got some stuff that my kids don't use. Should I bring that in? That would be lovely. Then bringing it in. Oh, I've seen something in home bargains that might be nice. Should I bring? Yeah, that'd be brilliant. So then you have the TA staff, you've got us, and then the families who have to walk past the room to get to put the bins out. What's happening there? Oh, we're just trying to create this space so you can have a bit of somewhere to play with your kids. Well, that's quite nice. And then starting to, the kids, this one of the highlights of my working life, was when some of the kids came and brought pictures that they'd drawn to decorate the space with. I thought that co-created space is so important. And there's something about not that just being a physical space, but a psychological space. So the families feel people are caring for me here. They've taken time to make a space for me. And that gives me permission to come in and bring my stuff into that space as well. So we now do weekly stay and play sessions in the space, in that accommodation. And we also, again, thanks Maria, do a staff wellbeing group as well, because we know how hard this work can be and how crushing it can be to be doing the work as well. So we want to support the staff who are doing it. So in terms of the therapeutic sort of stuff we offer, basically our overarching aim in all of this is to give families what they want, when they want and need it, and in a way that they can access it. As I was saying that, it just sounded like a song. I really, really want something like that. No. Okay, so the therapeutic input that we offer, we do antenatal sessions. That's all about like the social and emotional aspects of becoming a parent. It's about baby development, it's about bonding with babies, and importantly, it's about what parents need to feel supported at that time. We do that in group or one-to-one sessions. We also do work around the infant-parent relationship. So we use a lovely tool called the Newborn Behavioural Observation Tool, which doesn't sound lovely but is. And we sit and we watch the babies together. We have things like lights and rattles, and we see what that particular baby's interested in, how they might communicate, and we talk to parents about it and write a lovely little report which is from the baby's voice back to the parent as well. And that's a lovely bit of work to do. And then we also do therapeutic play sessions with families as well. And it is so moving to watch families be in a space where sometimes what happens is that for all of us when we become parents, if we become parents, we will be kind of revisited by some stuff that we've experienced before, and that might be unconscious stuff as well as conscious. And we might find we do lovely things with our babies and we can't explain why we do. But that's something that's happened that we've held on to and we're reproducing. There might be really difficult stuff that's happened that we end up reproducing and we don't want to. So part of our therapeutic work is to provide a space where families can kind of play out some of that stuff so they don't actually reproduce it in real life. And it's really powerful watching that happen, watching that in action, how families can bring trauma into the room, process it safely and leave it in the room. We also do couples and family work because we know if people are still in relationships, levels of domestic violence really increase in the perinatal period, and there can always be clashes between different families about what people think is the way to parent, so we kind of provide some scaffolding and structures to talk about that and find ways forward. And as I mentioned before, we do the wellbeing and consultation with staff as well. So we do something that supports staff to work in the zone of fabulousness, which is quite a phrase. Because we know that when we burn out, we tend to either get pulled towards, they say, enmeshment. So we either feel like we're the only person who can solve this problem, and that can be really, really hard to keep going in that scenario, or we have to disconnect to try and protect ourselves. And what we try and do within this model is bring us all back into the zone where we can keep the families at the heart of what we're doing. Why are we doing what we're doing? How do we stay? How do we stay in that area?